So this is a spreadsheet that I've created to let you make your own guesstimate about when we're going to reach herd immunity threshold. All of the cells that are shaded in gray are formula cells that you shouldn't have to do anything with unless you don't like my formulas for some reason. You go in and change them. But what you'll have to do is make assumptions here on line 3 and 4 about how many people have become immune through getting sick and getting over it or being vaccinated. And then you're going to make an assumption down here on cell B15 about the inefficiency discount. We'll talk about that in a second. But first you have to start out on line 3 here and make some assumptions about how many people you think have gotten sick and gotten over it in the past and how many will do that in the future. I started back in September, and I did this because we have that pretty good study, antibody study out of the CDC and the Infectious Disease Society that came up with 52 million people had gotten it by the end of September. And so I start with that as a base point. If you don't like that number, you can change that. And just to kind of demonstrate, if you change any of these numbers, it'll change everything in the formula. See, it also drops down here in the cumulative line, and the percentage down on line 13 changes. Let's go back to 52. And so then you've got to make some assumptions about what do you think happened the last quarter of 2020. I created sort of a little secondary spreadsheet here that you can use to make some guesstimates about this. I took the study estimate of 52 million. I divided it by the number of positive tests we had at the end of September. So I came up with a factor of 7 times. In other words, the number of actual cases is 7 times higher than the number of positive tests. And then I just applied that factor to each month after September to come up with these numbers as the cumulative number of cases at the end of each month. If you go back and look, I've actually come up with something that's a little bit lower than that, especially in the last 2 months here, because I just think that as we were going through that last quarter, testing was ramping up and we were discovering slightly more of the infections as a percentage than we had been previously. Then after December, you have to make some guesses about what do you think is going to happen in next year. I think we're going to reach HIT in late January, so I start taking the infections down pretty rapidly. After that, this is more or less consistent with what you would see in a traditional Farr's Law bell curve distribution. Then on line 4, you'll have to make some guesses about how many people are going to be vaccinated. Of course, nobody was vaccinated before December. I put in 5 million in December on the theory that we're going to get about 10 million doses in people's arms, and there's a 50% immunity from that first shot. And so that'd be the functional equivalent of having 5 million people vaccinated. I'm assuming we're going to get 20 million people vaccinated through the first quarter of next year. But as cases and especially fatalities start to wane, as we go into the latter part of the spring, I think people are going to have less sense of urgency about the vaccine, and you're going to see the numbers drop off pretty quickly as well. So once you fill all those numbers in, that'll give you these cumulative totals here at the end, and then the cumulative totals by month, which hopefully match the cumulative totals here. And so you can see, based on my assumptions, I'm assuming we're going to end up with about 167 million people getting the disease and getting over it for an attack rate of around 51%. That we're going to get something like 123 million people vaccinated, and that will be a 38% vaccination rate in the country. Now, this line 10 is something interesting we need to talk about for a second. We know that there's going to be 2 things going to reduce those numbers. The first is immunity, whether it comes from vaccinations or from getting infected, is not perfect. Not everybody that gets a vaccine and gets the disease and gets over is going to be completely immune from it. We also know that there are going to be some people who get the vaccine that have previously gotten immunity from having had COVID. And so we don't want to double count those people. Now, this is really kind of a wag at what this discount ought to be, but I put in 10% here. And that 10% then drives this number you see on line 10, which is a subtraction from the cumulative total. And so that's why, we end up with 290 million people either getting sick or being vaccinated and getting over it, but only 261 million people actually being immune for it for a final rate of 80%. Of course, this line 13 is the important number that we're looking for, because based on where you think herd immunity is, then this will be your gauge for when you think it's going to hit. Again, I think it's somewhere between 40 and 50%, so I think it's going to hit sometime in January, late January, maybe early February, and that's going to drive the numbers. But as you start playing around with this, what you're going to see is that it takes a lot to move these numbers very much. For example, let's just say that you're really pessimistic and think we're only going to get 10 million people vaccinated in January and February. You can see that really doesn't change the bottom line percentages very much, because the cumulative effect of this natural immunity going on at the same time we're vaccinating has a very powerful effect on the math. But you can fill those numbers out and figure out exactly where you think it's going to be. Now, down here on lines 17 and 18, I did something that's going to be a little bit controversial. I tried to project the total number of fatalities at the end of the epidemic. I used an infection fatality rate of 0.3%. That's a little lower than the CDC is currently using. But I think that as we go into having these therapeutic drugs, the monoclonal antibodies, and other things more readily available, I think we're going to see that have a big effect on fatalities. And then as we get more of the elderly population vaccinated, where the vast majority of the fatalities are coming from, you're going to see that come down pretty dramatically. So I think we're going to end up with an infection fatality rate of somewhere around 0.3%. That gives you about 500,000 fatalities based on an attack rate of 167 million people. Now, of course, a lot of people think this is controversial because that is a number of people who have died with COVID, not necessarily from COVID. And I make that distinction because well over 90% of the people have comorbidities listed on their death certificate. That means that when the doctor fills out their death certificate, he puts a cause down other than just COVID, whether it was a heart disease or diabetes or whatever the other cause was. And what we don't know, and frankly can never know, is whether or not those people would have died from those other comorbidities had they not had COVID. The only way we'll be able to get some estimate of that is to look at what the total fatalities are over the epidemic period compared to previous years in an excess death analysis, which I've written about a couple of times. But we won't really know that until we get all the way well into 2022 and we have the complete death certificates records for both 2020 and 2021. But this is the number that you see up there, flashing on CNN all the time about the number of people who've died from COVID. I suspect that we'll find that the excess deaths are quite a bit less than this, maybe off by as much as a quarter or a third or something like that when the final numbers come in. So anyway, this is a tool that you can use to make some guesses about what you think life in 2021 is going to look like, maybe make some travel plans or decide what you're going to do about your business. Anyway, I hope you find this is going to be helpful to you. Thanks a lot.